Hello once again, I'm Craig Andrus. Thanks for watching Call the Mayor Wichita. Your chance to call in and ask any questions that you might have. The number here is 316-491-5787. Joining me now, 6 feet apart. You might notice we're sitting a little more of a distance at this point. But there's only 3 of us in the studio, literally, the 2 of us, and there's a camera op in the back. So keeping our social distance, but also wanting to take your call. So go ahead, 316-491-5787. I know that the governor is coming out with opening up the state. I know the county still has some autonomy to make its own decisions. But Mayor, welcome to the show.
Thank you. Thanks for having me, Craig. And I'm looking forward to listening to the questions from the voters, from the constituents. So please make sure to call the number and ask anything you want. We have a lot going on at City Hall and a lot going on, of course, with the coronavirus and with the governor's new orders that I think are coming down on, is it Monday or is it Sunday night? Or
It does start on May 4th. So if you look at it, I took some screenshots here just to give you the brief overview. It's basically 4 phases. You're correct. The first phase coming in on the 4th, gatherings of at least 10. And of course, I know there's going to be a lot of reaction to that. What has been the biggest challenge for you during all this time as we wait for our first phone call?
So really for me, it's been more about trying to talk to the public about what is the intention behind these policies. In the beginning, there was a lot of argument over what is essential versus non-essential, right? Like it was a discussion about why is this business essential, but this business isn't. And really, it should be more conversation about what's safe and what isn't safe. And as we start opening up our economy again, we still have to keep in mind that this virus is out there. Bending the curve was supposed to make it so we didn't have a run on a hospital, right? So we didn't look like some of these other comparable cities where you have so many people who are sick that we have what's called preventable deaths. People who need medical care and they couldn't get medical care because there wasn't enough bed space. We did that. We were able to actually make it so we didn't have a run on our hospitals. The people of Wichita took this seriously. Now as we move forward, until we get either a vaccine or really good treatment, this virus is still out there, it's still a threat. And what we want to do is make sure that when we start to reopen, we do it safely. And the reason why is, the good and the bad, I guess, is that this is a global pandemic, right? Which is the bad thing, is that it affected a lot of areas throughout our world. But the good thing is that we can kind of take policy lessons from people in places that are comparable to us, throughout the country and throughout other nations as well, and try to learn about who did it right and who could have done it better. So with that, the reopening will be a tiered approach. It's focused on safety. It's going to make sure that as we reopen and as more normalcy comes back, it's done in a way that is not going to have that kind of backlash that some other places had, where they opened too far too fast, or they went too far too fast, and they wound up having a resurgence of people who got sick. So I think that's the goal when it comes to what the governor's trying to do. And the interesting thing about her policy is it sets these parameters, right? Like these what the boundaries are. But if, let's say in Sedgwick County, we start to see clusters forming at certain businesses over more so than other businesses, it allows the local Sedgwick County commissioners to enact policies that can be more restrictive. So having that customization that will be right for Wichita and for Sedgwick County will allow us to respond fast if things start to change.
So there is some autonomy there. All right, let's get to the first call, 316-491-5787. That is your number. Ken, you are on the show. Welcome. You have a question about malls. You are on the show.
Ken, thanks for calling.
Yes. My name is Ken Smith. I'm the owner of a small business, Steve's Jams and Jellies. And I would like to know, when are the malls expected to reopen? Because the governor was kind of vague on malls. I understand the big venues and the little venues, whatever. But what about malls?
That's a really good question. Because, I think that for the short of it, I'm not sure. I'd have to double check. Last thing I ever want to do is give out information that would be inaccurate. But the reason why I think this is an interesting question is, your small business, so long as you can keep social distancing, so long as it falls within, and I'm not sure. Well, actually, you said you sell products. You can take these precautions that can make both yourself, your clients, and your employees safe. However, when it comes to the gathering rules, I'm not sure in a mall type atmosphere where that would, where the line would be legally. So that's a very good question, one that we would have to, I think, look into a little bit, where I'm sure all those businesses that can, impose proper, safe practices would be okay, but does the mall constitute a larger gathering? From my understanding or the briefing I got about the governor's tiered approach, on the fourth tier is when they're really starting to reopen big events. That's when you want, that's when, like concerts in a park and that type of stuff would be appropriate once we get further down the line. I'm not quite sure where malls are going to fall into that. So thank you for the question. It's something I'm going to have to follow up on because I'm sure that if you're wondering it, there's probably lots of other people wondering it. If I get an answer for you and you follow me on social media, I'll make sure to post it.
All right, 316-491-5787. That's your number. You can call and ask a question you have of the mayor. Betty, we appreciate you calling. You're on the show, Betty. What is your question?
Hi, Betty.
Hi, good evening, Mayor. My question is with our commissioners, our city commissioners and the county and our governor, where do they think they know more about the disease than our infectious doctors and our medical society doctors and want to open?
Okay, so we threw DC in there, so it kind of threw me for a loop. I'm not sure. You have the Trump administration, they have their people that they're listening to. The county commission actually serves as our board of health, and with that they have access to medical experts and resources that is advising them in that role. Same thing with the governor. The governor has Secretary of Health. She has policy experts who are helping formulate those policies as well. And you might actually see some disparity. And maybe this is getting to the root of your question when you talk about DC or Kansas or Sedgwick County. Because we're different forms or different levels of government, we have different variables to take into consideration. So, for example, what the federal government might do might not be, hopefully not, would be effective, but might not be as effective for a place like Kansas. So, the federal government might start here with their guidelines, and then the state of Kansas, based off Governor Kelly and her team and the policy experts, might bring it to here. And then that might work in most Kansas, but then let's say Sedgwick County or Johnson County or Wyandotte County have more particular issues, right? Let's say they have more nightclubs and they're finding out that close dancing with people are making this spread even more, where they can actually bring those regulations to here. They can tighten them. So I'm not sure so much if it should be perceived as, are these people saying they know more than those people? I think that if we do this right, we have medical experts, we have public health experts who are advising the policymakers, and they might be seeing things a little different, where what's right at this level of government might need to be fixed at this level of government, and therefore you get kind of two products, but they're right in their own environment.
Okay, we do have another caller. Okay. Lisa, you're on the show. Welcome. Lisa, what is your question for the mayor?
Yes, I was wondering if you're going to open up the eye doctors and dentists for business again.
Okay, so very good question. To be honest, and I want to be very honest with this, because I get a lot of emails and text messages and social media posts. I try to be very accessible, but because of that, I think that people wonder if I have the power to reopen stuff. Kansas is a little different than some of our neighboring states. So if you kind of look over the border and you see what the mayor of Kansas City, Kansas has done, that mayor has complete control over enacting these type of policies, right? Like overarching policies for the safety and health of his community. He can do that. In Kansas, that power, as mentioned, falls to the governor or to the county commission. So as mayor, I've had a lot of people reach out and say, can you make an exception to this, or can you do that? And sadly, the city council and the mayor, we're somewhat powerless to change any type of regulation that comes from the governor or from the county commission. They're the ones who serve as a board of health. I describe that our role at the city level is we're in the same car, but we're in the passenger seat. So if you're looking for certain businesses to be open or to have other exceptions, that's going to be something that the governor's office will have to either make an exception of if their order prevents it, or the county office. Now, I'm not sure with other health professionals, and I have to kind of get more into the weeds, I think, with this policy, where they fall on the list. What tier are they? Because just, I think, less than an hour ago, or maybe less than 2 hours ago, the governor came out and talked about her plan for the next few weeks. So it'd be interesting to see where dentists and where eye doctors and some other folks kind of fall on that list. But I do want to also point out that one of the really terrible news that I've heard is that there are people who might be suffering from some type of ailment, and they actually didn't go to the hospital in fear of the coronavirus, or thinking that they wouldn't have a bed because other communities were overrun by the coronavirus. And some of these stories I hear is someone might have chest pains, and if they would have got to the hospital sooner, they could have gotten something done where they would have been okay. But because they waited out of fear of the coronavirus, or out of miscommunication or misunderstanding of these ordinances, that they didn't have the option to go to the hospital, they wound up waiting too late. So one of the things that you might be able to put off an eye doctor or a dental cleaning or something, but if you are suffering or think you might have some major medical situation happening, please still go to your doctor, still go to the hospital. The stay-in order does not apply for people who are suffering major medical conditions.
All right. Thank you, Mayor, for that answer. 316-491-5787. Give us a call. We do have somebody else on the line right now. Let's get to Patrick. Patrick, I understand you have a question about getting some help. Welcome.
Hey, Patrick.
Hey, thanks for taking my call.
Of course.
I just had a quick question. I'm a small business owner and a local employee. I've lived here all my life. Mm-hmm. My question is, with all of the misreporting on, so if somebody gets in a car wreck and, they've had the flu or they've had a cold, which is a coronavirus, they're diagnosed with COVID-19 presumptively, and on the certificate of death, they just presume it's coronavirus. So with all of this misinformation and the hospitals being paid off for diagnosing coronavirus, do you, as the mayor, and do you expect the governor to take any form of responsibility for the millions displaced, the millions that are going to starve to death in the third world due to the American economic shutdown, once this all comes out that this is no worse than a average flu?
So, it's interesting that the caller discusses misinformation. I think there's a lot of misinformation, particularly perhaps about that perspective. First of all, we've had 6 deaths in Cedar County related to the coronavirus. I've heard, that's the first time I've ever heard any idea that if you die in a car accident, then they're going to say you died of the coronavirus because there's an incentive for that. There's not, and that's one of the problems with this is we've never actually faced a pandemic like this. And as a society, we really, when you have restrictions like the stay-in orders or these other things, like it really kind of stirs up, I think, a lot of mistrust and a lot of concern, and people, I think, process that differently. Moving forward, the evidence that this was real is real. Like, I don't know an easier way to say this. Like, I think we have about 70 or 80,000 people who died. in our country. To put that into perspective, it's about 8 or 9 times 9/11, Pearl Harbor, and Katrina all added up, times 8. And that's if no one else dies. And I use that because we're not talking about, oh, it's the same as the flu or a cold virus. We know people succumb to that, to those viruses every year. This was a pandemic that had, beyond the numbers, real societal effects. It's more comparable to a national disaster, I think, than just getting sick. And I do want to correct any type of misinformation. This is not the cold. This is not the flu. It is more than 10 times worse than that. Although a lot of us might get this and not have symptoms and be okay, it's nothing to not be concerned about. If you are exposed to someone with coronavirus, you should go and get treatment. And it's highly contagious. So we should not be associating this with a type of virus that has been in our community for a long time. I mean, that's just academically wrong. I think it brings comfort to people to think like that, oh, it's just like a cold, or it's just, the reality is it was a completely new strand of virus, and it got out into our human population, and it has just done terrible things to our entire to our entire planet. But again, we're talking about the things it did to our country are things we never thought we'd see. I mean, there were mass graves in New York. Like that's post-World War II type stuff. Like that is stuff that it shows the effects this actually have. And I don't think we do our healthcare workers justice, or the people who have succumbed to this justice, by trying to somewhat downplay that.
We have an interesting perspective from the next caller. Let's get right to it. Next caller, is it Rachel? Apologies if I didn't hear it right. You are on the show. You have a question about churches. Welcome to the show.
Hey, Rachel.
Yes, good evening, and thank you for taking my call. I just wanted to find out or get a better understanding. Is churches open?
So I would have to double check, but I'm pretty sure that there is, religious gatherings aren't any more restricted than anything else in the order. I'd have to double check this new order. Like I said, she just announced it, and it's quite complicated. She just announced it, I think, at 6:30. I will say that, remember, it's about what's safe more so than what is allowed and not allowed. And I can't really stress this enough, where there's no blueprint, right? This is the first time in over 100 years our country has seen a pandemic like this. So going forward, I think orders and policies in place are made with the best intent, but we as individuals, as Wichitans, we have to think about what's safe and what isn't. So if you're in church, is being in church any more dangerous than anywhere else? It could be. If you are shaking hands with people or sitting within 6 feet, pretty much anytime you can expose yourself to people's droplets, right? Which is, they stand close enough where when they speak, you might get some of their saliva on you, or if they sneeze, and then if you get those droplets in common touch areas. To answer your question directly, I'm not sure where the order stands when it comes to churches. Craig Mighty, I think he actually was able to do some reading up on this before we got here. And also, beyond that, I just want to make sure that people know it's not about, the governor isn't, I think, supposed to say this is safe and that's not safe. The reality is, being exposed to this, the only safe way to do it is be exposed less, right? To put yourself using precautions, and regardless where we are at.
Well, testing came up in that, which is a great segue for our next caller. 316-491-5787. Give us a call. You can ask anything. I know we're getting a lot of COVID-19 questions,
yeah,
and we kind of expected that. Corleone, you are on the show. Corleone, welcome.
Welcome. How you doing?
Doing well. How about yourself, sir?
Thank you. What is your question?
I had a question that I wanted to make sure I was informed correctly so I could continue to inform my people who
Of course.
I'm close to, friends, loved ones, and family. What would be the exact protocol for getting a COVID-19 test, whether you have insurance, whether you don't have insurance, etc.?
Okay, so the exact protocol to get a COVID-19 test is to first dial 211. Dial 211, they are our nonprofit go-to pretty much. It's a United Way, but they have been tasked with going down a list of potential symptoms. Jeez. See if I can talk tonight. I'm normally in bed by now, by the way. This is me staying up late.
Well, you do have small children.
I do, yeah,
so
right.
The question is, of course, are they watching? But
right, and they might be. It kind of blows their mind if I'm on television. So you go to 211 and you say, hey, I feel ill, or I think I've been exposed to COVID. And then they're going to go down a list of, do you have a fever? Do you have these certain symptoms? And remember, we have other viruses in our community right now where you might get sick and you're sick, but you're only hearing about COVID, so it's very easy, I think, to psychologically think, I wonder if I have COVID. If you have they go down a list and you have the symptoms, they will then direct you and create an appointment for you to go get a test through our county commission. The county will, their health department will test you if you are recommended by 211, by United Way, and they think you have those symptoms. You can also get tested privately. That's another interesting thing with the conversation about tests is, if you go to your doctor, let's say your family doctor you've been with for a while, and they think that you need a test, they will do very similar where, we're not just testing people because they want tests. Like there's just not enough tests to just do that. You have to have symptoms, and they can test you as well. And I don't think those numbers are actually as reported as the county numbers. So some of the numbers reported about how many tests the county have, I don't believe that includes the tests available at your private doctor. But if you don't have insurance, get back to your question, call 211 if you think that you have symptoms. They will go down a list and they will refer you to the county where you'll be able to obtain a test.
All right. Good question. Thank you very much, Corleone. 316-491-5787. That's the number. And we do have another caller. Let's get to Scott.
Hey, Scott.
Scott, welcome to the show.
Yes. My question is, before they had this pandemic thing, the police were unfairly targeting the black community. It seemed like they were behind every building and bush. I understand that they need money down in the city. The municipal court of course, that's what they're there for, is to, get money off the community. But maybe the mayor has some kind of economic plan where they can create some type of money coming into the city through jobs or businesses, so they don't have to just mistreat the community so badly to get money here. I understand the city needs money, but there should be a more creative way of getting that money than just victimizing the community. Thank you very much.
So, and very good. Very good, kind of bringing us back to economic development. I think the caller is right, and there is a perception that that certain communities are targeted, particularly by law enforcement, than others. I will say that our current chief of police is been exceptional in going out and building relationships. And one of the things I think that are going to help with community relationships, particularly with our law enforcement, is community policing. Allowing enough police officers, throughout our city where they can build relationships with people within the community and not just, kind of go into different parts of the community when there's problems. That's actually been shown nationally to lower crime rates and to increase satisfaction with police officers and with the community, because it's a partnership at that point. And to talk about just a little bit where, and our current chief, by the way, has stressed teaching, kind of getting away from, I think, an older way of policing into using discretion, where not saying you have a ticket limit so you need to go out and make this much money, but making sure they use discretion where if you are, the way he tells it, if you pull someone over and you could tell that they don't have a history of driving recklessly, and that this ticket might really hurt them financially, then you can give them a warning. So the chief has been very, I think, proactive in trying to not only create relationships in the community, but also make sure that he is preaching to other officers, I think, more taking individual situations into account. But you also mentioned a good point about economic development, about jobs and about making sure that as we get through the coronavirus, and I know everything's kind of been all about the corona pandemic, how do we rebuild after this? Just yesterday, the City Council had a economic development summit where we started looking at the tools in our toolbox to create the environment, to attract more jobs here, and also to try to grow and expand the businesses that are currently here. And there are a lot of incentives out there for both federally and at the state level and at the local level. And part of that conversation is how do we get those incentives lined up, particularly for communities, parts of our community that might not have as much economic development as others. So using opportunity zones, using some of these other tools. So that conversation is happening in the background. I just think right now a lot of us, we're focusing on getting information out about COVID because we want to make sure that we save lives.
A lot of COVID questions, and those will continue. Call the mayor of Wichita, ask anything you want. That can, of course, can include COVID-19.
I will answer any question.
316-491-5787. That's the number. Our next caller is there, so let's get right to it. Jerry, you are on the show. Jerry, welcome.
Welcome, Jerry.
Thank you. I've got a question. I'm looking at the Wichita Eagle from 416, and it's talking about the coronavirus numbers as opposed to the influenza numbers. And it appears to me that there's more influenza numbers at that point in time than there are the COVID. So
that's right.
Is that anything we're concerned about at all, or are we just blowing that off?
Kinda. So, and this kind of gets to, I think, some of the misinformation out there. So influenza numbers, or the flu, we'll call it because I stumble over my words. Of course, there's going to be more people with the flu because we have been battling the flu as a society, for over 100 years. We've been exposed to the flu, and although it changes, it slightly mutates each year. We've been able to, kind of combat it with vaccines, and we have treatment for the flu. If COVID was as prevalent into our community as the flu, that would be awful. And that's one of the problems. I don't think you can really look at the numbers where we have more flu than we have COVID, therefore flu is more dangerous, because we actually have defenses for the flu. COVID is a virus that no human had a immunity to until they actually faced it and went through it. It comes from a strand or the family of viruses that the cold virus comes from, not from the flu virus. And my mom used to tell me there's no cure for the common cold, right? Like if you catch the cold, you're just pretty much gonna tough it out. We don't have a vaccine for the cold. It's a nasty family of viruses that are just really tough to kind of pinpoint, but because humans have had colds so much throughout our time that we've built up immunity to it. COVID is a mutation of a virus that we have no natural defense for it. Our bodies will likely fight it off. The majority of people who catch it can fight it off. It's not a death sentence, but it's really not medical experts don't compare the numbers kind of in that way, just because the sample, the population who actually catches the flu is so much higher than a population who catches COVID, and that's really where we want it to stay because it is such a more powerful, dangerous virus that we have undergone these measures so that we can stop the national death count at, I think, 80,000 people.
All right, thank you for the answer, Mayor. Call the mayor of Wichita, 316-491-5787. Grace is our next caller. Grace, thanks for calling.
Hey, Grace.
Hi. Hey, I got a question for you. You're all talking about not getting enough taxes in. why don't you start making these people who are not paying their property taxes and get that paid instead of letting all these slumlords buy up all these cheap homes and then rent them out and then not pay their taxes?
So the question is about taxation. Our budget is actually going to be hurt, not because people aren't paying their taxes, but because the COVID virus has shut a lot of stuff down. We have things that we're going to help bring in revenue, big events that we do, tourists, different things coming, conventions coming. We have about a $5 million to $10 million deficit over the next year of what was projected to happen, to plan off of versus where we're at now. So I understand that there is a concern about taxes, particularly when it comes to property taxes. I think they're one of the worst taxes really out there because we keep seeing property taxes increase while wages are still stagnant, or while it still costs a lot of money to goes up every year, the cost of living here in Wichita or in Kansas when it comes to inflation, and our property taxes go up. And that's very tough, I think, particularly for people on a fixed income. Those who did everything right, who worked, they're living off their pension, living off Social Security, and then they kind of haven't done anything different to their house, but keeping it up, and then you kind of feel the squeeze when property taxes go up. So as a city, we are looking for ways to cut the budget. We are not looking to tax our way out of it, but other and maybe one of these federal relief packages will actually come down and help us out. I think that was the intent with one of them, to try to make us whole. I think looking forward, taxation is something we need to keep in mind because our budget's suffering at the city, but your budget's definitely suffering too, right? Like folks, we're in a natural disaster that we're going to have to rebuild from an economic standpoint as well. So that's our goal, is not to shift. I think every elected official doesn't want to shift the burden to taxpayers. We got to figure out another way to move forward without overly hurting people.
Okay. Call the Mayor of Wichita. Your number is 316-491-5787. And we got a couple of these stacked up. We'll get to your call just a second. I know we got one there, but on Facebook side, if a person is ordered to quarantine and they refuse, will law enforcement become involved? Mayor, your answer to that question.
So, the enforcement from the city side has been mostly using education. And the reality is, you get an interesting constitutional question that I think academics will actually be able to talk about moving forward, right? Where, let's say if I have the virus and I'm highly contagious, and I'm not going to die from it because I'm healthy. So I'm going to go on with my life, right? And selfishly go touch common areas, get close to people. And now I just gave it to someone who I don't know's, to them, or to let's say my mother-in-law, who is old enough where she could very easily die from this virus. That's really the question, the legal question, right? Like, do you as an individual who know you're sick, who know that you are highly contagious, do you have the right to go out and spread this to other people who might die of it? And where is law enforcement's role in that? I do think there was a case where I want to say maybe the county, maybe it was a sheriff who actually did arrest someone who was actually that selfish. Someone who actually was highly contagious, going to go out and didn't care, apparently, if they have infected a small child who just beat leukemia or an elderly person who would likely die of this. And that's really something that we have to take into account. I think personally, from my position as mayor, when we utilize law enforcement, it's just been education. It's, hey, this is the problem of doing it like this. We had one business who brought in people into a tight quarters for their business, and they said, hey, we're just going to defy the order, we don't care. When our police officers went out there and talked to him, and pretty much said, like, you could not only create clusters for the people who are here, but those people, when they go out and they, utilize common areas, they could pass that on to someone who didn't sign up for that, someone who just needs to go to the store to get toilet paper, and now you have someone who's infected because they weren't responsible, infecting that person.
Okay, next caller, 316, of course, 491-5787. That is your number. Clay, you are on the show. Welcome, Clay.
Clay.
What is your question?
Hey, I just wanted to call, and I'm a manager at a small business here in Wichita, and we are concerned about the unemployment, that the amount that individuals are receiving for unemployment. Specifically the $600 a week that they can get on top of, I think it is 2/3 of their, a sort of average pay they get on unemployment, and then that extra $600 from the federal government would be, for most of our employees, would be more than they would be making at work.
Okay.
So it's kind of a very scary thing for us. Anything that any highlights on that?
It's interesting. Again, our system was just not set up for what we're going through. Where I get the most heartbreaking messages, and every time I'm here, by the way, my earpiece falls out. I thought we had that fixed. So give me 1 second because I have it. The worst messages I get throughout the day are the ones of people who are struggling with unemployment, trying to make their claims. They haven't had checks for a few weeks, and they have kids. They are actually trying to stay in, be responsible by not going out and possibly getting themselves infected. And unemployment's supposed to be there. It's supposed to be, if you do it right, it's a safety net, but it's not a hammock, right? Like it's enough to get you by, but you also want to, you want to bounce back up and get back on your feet. We're in a very interesting situation where, unemployment and the rush on unemployment benefits, I think it's up like 5,000% or something huge, where their system, it's a department up in Topeka, when I was a legislator under the Brownback era, it's just cut after cut after cut, so they're already kind of hanging on by a thread as far as what they can manage. And then when you add the extra, I think, overwhelming traffic, it jams a lot of things up. So the unintended consequence of that, I think, and really of the policy, the federal extra $600 that you're referring to, is kind of an example that, I don't think anyone predicted something like this would ever happen, right? Because we have people who deserve unemployment, who have paid into the system. Their job is no longer there through no fault of their own at all. And they can't get through right now. They're having a hard time accessing that. And then over here, when you talk about the $600, that's kind of on top of what unemployment is, and it usually is. You're making a really good point where cost of living is different throughout the country, right? So the reason why you have a formula is so you don't run into the problems you're referring to, where that $600 on top of the formula for the unemployment that they normally get might actually add more than what they might be making at your business. However, in other parts of the country, it might not at all. Like in California, cost of living might be higher, which is one of the reasons why the federal government is really bad at doing kind of blanket legislation. So that $600 is coming from the federal government, and they're trying to utilize more of a national standard. So cost of living might be higher in other areas. Here in Kansas, we have a formula, and normally it's to encourage people to go back to work. And we just are in this incredible, literally once in 100 years situation where I think there's no blueprint. People on a federal level and on a state level are doing their very best, but you're gonna have these unintended consequences. And my advice, not only to this, but really to the people who are struggling with the current system, right? Who are trying to utilize unemployment and get through this, is just to realize that a lot of these people behind the scenes are really good people who want to give the best service possible. It's really just the size of the situation we're in that I think we have to take into account when there are these unintended consequences of overloading the system, or the national government adding more to the unemployment, which is causing the unique problem that you brought up.
Okay, we actually have a non-COVID-19 related question.
Okay.
It has to deal with the new water treatment plant that we have. I know that the financing has come through. Call the Mayor of Wichita, of course, 316-491-5787. Caller, Joe, welcome to the show. What's your question, Joe?
Hey, Joe.
Thank you for taking my call, Mr. Mayor. I would like just a general status report on the progress toward a new water plant, financing, planning, a timeline, whatever else you can give us.
Okay.
Thank you.
So I left my notes in the car, but I actually talked about this a little bit at my briefing. We were able to get a WIFIA grant from the federal government, or not grant, loan from the federal government that is going to help us, with the building of the new water plant, and that is actually going to save us, I believe it was $96.5 million to the taxpayer. It was it was a ridiculous amount of money, of taxpayer money, that we are going to save because of the rates we're going to get from the WIFIA grant than from other means. So, and I have to make this clear that we went to Washington before COVID, because I think I mentioned this at my press conference, and someone said, "What are you doing in Washington? There's not supposed to be traveling." And yes, this was weeks ago, or months ago, I don't know. Anyway, a while back. Part of our goal there was to meet with department heads so that we can try to secure some of this type of funding that will save taxpayers money. And that was one of the successful things of the trip, is talking with people who help administer those type of grants, because in the long run it will stabilize the cost of water. And like I said, it's a over $90 million savings to Wichita taxpayers.
Okay, call the Mayor of Wichita, 316, of course, in Wichita, 491-5787. That is the number you can call to ask whatever you want. We do welcome any questions, so it could be non-COVID related. We do have another Facebook question. Let's get to that. Question is, if federal and state buildings aren't open to the public, why are other businesses safe? I believe the assumption there is why is one open, not the other, perhaps. Mayor, your answer to the question.
So I should have read it instead of looking at you, by the way. I didn't see it was on the screen.
So
if I only get part of it.
Federal and state buildings
aren't open to the public. Aren't open to the public. Why are other buildings safe? Okay. So again, remember, it's not really about the building. It's about the activity and about what is necessary at this time. So we made a decision to close down municipal court. When this started. Municipal court is really where you go for like traffic violations, for stuff that are more misdemeanors, not really stuff that we could put on the back burner, right? Like, do we want to bring a bunch of people in tight quarters and expose them? So our government building is closed for that, or at least the court is. However, government still has to function. If domestic violence situations arise, we need to make sure that we have people on hand who can go out and help victims. So we have to make adjustments to our budgets moving forward, so we can still be responsible stewards of taxpayer money. So the council still meets, even though sometimes we do it online, or some members come in from online. So it's not so much about why, is there a contradiction where why are you open but I can't be open? It's more about what is necessary. I think we all agree that police and fire at this time is necessary, so City Hall needs to stay open. But maybe we can hold off on making people pay traffic tickets or parking tickets, right? So municipal court we can close. I think that's a decent compromise. While over here, we need grocery stores open. So are they more safe than another public gathering? Really, no public gathering with people who you don't live with coming within 6 feet of you is recommended at this time. So if you take the right precautions and you utilize, I think, some of these services only when necessary, that's the best way to lower the spread of COVID. And to be honest, Wichita has been doing very well with this, and that's why we aren't seeing the same type of death rate as other comparable cities.
Thank you for that answer. Call the Mayor of Wichita. Your chance to ask what you'd like, 316-491-5787. We have another caller. David, you are on the show. Welcome. David, what's your question?
Thank you very much. So, Mr. Mayor, I own and operate an agency that serves adults with intellectual disabilities. One of the challenges I have, I was able to obtain a loan through the Paycheck Protection Program, and I want to call back my employees to come back to work. However, we don't have any clients to serve, number one. I guess number two would be the state is sort of restricting how soon we can bring back the more vulnerable population, which I completely understand.
Of course.
What is your opinion about dealing with the SBA if we're prohibited from bringing back the workforce under one of these loans? I just would appreciate hearing that from you. So,
and I wish I had a better answer than what I'm about to give you, because I've gotten a lot of calls, and being mayor, and this kind of shows it, where my job is city hall, is city stuff, but of course I take a lot of calls about what's happening at the state level, and also what's happening at the federal level, and I try to stay as up to date on some of this stuff as I can, but particularly when it comes to implementing some of these really new programs, these new loans, these new packages that came down from the federal government that have not, I think, met the same intentions or the same standards that were intended. I mean, you're making a good point where you're able to get this one loan that's supposed to allow you to go do this, but then you're running into some problems with the stay-in orders and so on. So I really wish I had a more concrete answer on. I think maybe a lawyer would, maybe a good tax lawyer. So if you know someone who does law or finance law or tax law, they could probably help a little bit. I think that, but I'll let you know that your question is not unique. There are lots of people on my social media, because really I communicate most through social media because we're all social distancing, who have been asking about these new federal tools that were designed to try to help us get through this. But there is a lot of unclear aspects of it, where can I use it for this or can I use it for that? And eventually I think that we're going to need some legal opinions to help navigate those people through it, and people like yourself to make sure that you are keeping your business afloat, that you are maintaining what the purpose is, which is in your case very honorable to work with with the disabled population, but also making sure you're utilizing that money in the manner in which it was intended. If you follow me on social media, and if I learn more information, I'm usually someone who posts that information, even if it doesn't have to do with the local level government. I have been posting other stuff to try to help out people like yourself who have those questions.
All right, thank you for that answer, Mayor. 316-491-5787. We have time for more callers. We do have another caller on the show. This is Varen. Welcome to the show, Varen. What is your question?
Hi, Varen.
Good evening.
Good evening.
So my question is to focus on the topic of bringing back manufacturing jobs to Wichita. Especially right now, we have a lot of companies shutting down or reducing, jobs, and we also have growing frustration of many manufacturing companies trying to bring back their supply chain from China. So could you please shed some light upon what you're doing as the mayor, coordinating with the senators and the congressmen, and as well as state legislature for incentivizing any special measures or tax benefits given to companies to bring back these jobs to Wichita, and also that way you can retain the talent that we have in Wichita instead of losing them to other states.
Incentives. Thank you, Varun.
So, very good question, because one of the problems is particularly not just losing jobs, right? Like that is a major problem, but also losing that workforce, that talent that will go get jobs somewhere else. Wichita is home to the best workers in the world. We have not only do we have this culture of building airplanes or manufacturing, along with a business culture, right, of entrepreneurship, but our academic institutions reflect that as well, where you can go everywhere from WSU Tech, where they have been able to kind of spin on a dime when it comes to revamping their programs to fit the economic need of what's happening in our community. But those programs actually stack on top of programs that lead all the way through Wichita State up to doctorate level programs in engineering, in chemistry, and biology, in mathematics. So Wichita as a community, we have this incredible workforce, and then we also have our educational institutions that are lined up to collaborate with everything from working the supply chain all the way up to quantum theory on design stuff, I guess. I don't know. Anyways, so to get to your question, what are we doing? First of all, you're right, it's a collaborative approach. We have to make sure that Wichita is working with the county, with and with the state to not only try to bring in new jobs and new opportunities, but see what ones can we grow here. And what's a good fit? Like, what's a good match? Like, we want the type of businesses that, or type of manufacturing particularly, that complements our current skill set. Some of those talks have been on hold, but as you probably read, I think there's a big push for people who are going after Tesla. There's been a big push for other types of manufacturing that complements the workers we have. And then we got to become innovative. The reality is we never diversified. Like during the last recession, when people came out and they said, we have to diversify, we got to get more diverse as far as our economy. Wichita said they were going to do it, and this sounds harsh, they didn't do it. Like the data set shows that we still kind of had most of our eggs in one basket, which was aviation. So for us to move forward, we have to, I think, really take a page out of Wichita State's book, which right now they have been focused on technology, right? Like, what is the next economy? What's going to make us more recession-proof? And that is going to be getting into, I think, the digital age, getting into technology, putting products up into the cloud so that you can be in different economies at once, right? Like, so you're not just subjected to the ups and downs of the aviation economy. If we do this right and we get more into technology, and we could actually sell products throughout the world and just bring money back to Wichita and grow jobs here. So I think we also have to be forward thinking about not just diversification, but the right type of diversification that actually builds on top of our foundations.
All right, got time for another couple calls here. Julie, welcome to the show. What is your... Oh, Julie had a question.
Oh, no.
She's apparently not there anymore.
Sorry, Julie.
Julie, you got like 1 minute. Call back. 491-5787. So we do have some things coming up with the city. I know that the summer reading program, I'm told that's back online now.
It is. We got the summer reading program. We actually made some changes to our... and one I think we should talk about because it's very important is also our food program to kind of fill in the gap between kids who normally get food over at the schools. We have found out ways that we can still offer them food. So we're trying to get summer reading back on board. We're trying to get our food programs back on board. We are going cautiously, I think, back to what resembles normalcy. But again, it's about safety, and it's about making sure that as we move forward, we do so making the changes that are going to promote good health.
It is a time of change. Julie, you're back. I'm glad you called back. Julie, what's your question?
Yes, I have a question about the city offices and county offices. I was specifically wondering when the DMV might open. I'm wondering what people are supposed to do if their license is expiring or whatever, and they're not able to get in because they're closed.
That's a really good question. So the DMV falls into the county commission lane. So I don't have any hard dates for you, to be quite honest. But the city doesn't run the DMV. I think they run out of one of county buildings. So they would probably be able to address that. So I wish I knew, but I mean, like I said, we have a lot of these unintended consequences with these type of stay-home orders. Is you're right. What if your license expires and you still have to get to the supermarket and back? You know, we're trying to get back to normalcy while keep people safe, and these type of issues are something that we're going to have to address moving forward.
Okay, we got brief time for one more caller. Gene, if you are there, welcome to the show. Gene, what's your question?
The question was, after the meat has been frozen coming from the factories, does that kill if there's any disease in it once it's been frozen?
So that's a good question. I think there's a two-point question to that. I don't think there's any evidence that our food supply, the same problems with our food supply. But my understanding is, you know, if we take your question and take it out of the context, is that, you know, how long can a virus live? My understanding on surfaces, it's not very long. What do you think, Craig? What if the virus was on a surface and then it gets mailed out? Like if we take it away from, because I don't have any thoughts that food would carry it more than anything else, but I know that
you know, iteration of health official you want to listen to, it does vary some, but I know that they've talked about the food chain, and you might find some of those resources. I believe the city of Wichita has posted some of those resources talking about meat packing plants, some of those. I know Sedgwick County has posted those as well. So you might find some answers there talking about how long the virus lives. And specifically to your question, Jeannie, is the food safety question. So.
Right, and I haven't had any evidence to suggest that the food isn't safe, but I think if we were to, you know, like I said, try to take that question longer or to a bigger scope, also, you know, is any package safe that might have been in contact with this? My understanding is, you know, it's droplet based. If droplets dry, then the virus also dies.
Okay, well, take another call, but we only have 30 seconds left.
Oh, no.
So we love all your calls, seriously. Thank you so much. I know we got a lot of COVID questions, and I appreciate the non-COVID questions as well, because life goes on, right?
That's right. And in the last 20 seconds, I do want to just mention that we are offering free bus rides on Saturdays up until the end of June. Yeah, Saturdays are our least traveled days. Okay. And so if you are someone who has to get to the supermarket and money's tight, make sure you know, you can check out our bus route on Saturdays.
All right, thank you, Mayor, and thank you for watching. We'll see you next time on Call the Mayor.
Thanks.